listen to me, because what I am about to tell you could be the difference between a retirement filled with financial security or one where you are drained dry by healthcare costs. You are worried, I know you are. You look at the cost of doctors, the cost of prescriptions, and you wonder, how am I going to pay for this when my paycheck stops? The biggest fear I see today is the fear of outliving your money because of a medical crisis. But there is a tool, a powerhouse of an account, that most of you are not using correctly, or worse, you're afraid of because you don't understand the rules. I'm talking about the health savings account, the HSA. Now, don't you dare confuse this with a flexible spending account, that use it or lose it trap. No! An HSA is yours. It is your money, it stays with you forever, and it is the only account in the entire United States tax code that gives you a triple tax advantage. You put the money in, and you get a tax deduction, that's one. The money grows inside the account and you pay zero taxes on the growth, that's two. And when you take the money out to pay for a doctor, a dentist, or even your Medicare premiums, you pay absolutely no taxes on the withdrawal, that is three. That is a triple threat against the IRS, and you need to be using it. But here is where you have to be so careful, especially if you are approaching 65. The question I get all the time is, Susie, can I keep putting money in once I'm on Medicare? The answer is a big, loud no. The second you enroll in Medicare Part A or Part B, your ability to contribute to an HSA stops dead in its tracks. And listen to me closely, if you delay Medicare because you are still working, but then you decide to sign up later, Social Security will backdate your Medicare enrollment by 6 months. If you are still putting money into your HSA during those 6 months, you are going to face a tax penalty. You must stop your HSA contributions at least 6 months before you apply for Medicare or Social Security benefits if you are over 65. Don't let a simple mistake take money out of your pocket. Now, how do you use this in retirement? This isn't just a medical account, it is your stealth IRA. Once you turn 65, the rules change for the better. If you need the money for something other than healthcare, maybe you want to take a trip or help a grandchild, you can take the money out for anything. Yes, anything. You'll pay income tax on it, just like a traditional IRA, but the 20% penalty disappears. But my goal for you is to use it for what it was meant for, your health. Did you know you can use your HSA to pay for Medicare Part B and Part D premiums? You can use it for long-term care insurance premiums. You can use it for hearing aids, dental work, and glasses, things that regular Medicare often doesn't even cover. So, here is your actionable takeaway. If you are still working and you have a high-deductible health plan, you must maximize your HSA contributions today. For 2026, if you are 55 or older, you can put away $5,400 if you're single, or $9,750 for a family. Do not spend that money now if you can afford to pay your medical bills out of pocket. Let that money sit. Let it be invested in the stock market. Let it grow for 10, 15, 20 years. When you reach your 70s and 80s and those medical bills start rolling in, you won't be panicking. You'll just reach into your HSA and pay the bill with tax-free dollars. That is how you create a safety net. That is how you stand in your truth and take control of your financial destiny. You can do this, but you must play by the rules.